Hello, hello. Okay.
I haven't actually got an answer yet, but I'll look it up.
Just make it as you go along, that's what we do. Vet Talk video and podcasts are proudly supported by the Animal Referral Hospital.
G'day, I'm Brian Pickering.
And I'm Kay Brown.
And welcome to Vet Talk. Well, at long last, we're coming to you live on a Saturday, in fact, from the Animal Referral Hospital at Homebush. And our very special guest, who just also happens to be co-owner, is Dr Sarah Goldsmid. G'day, Sarah.
G'day, nice to see you here.
And welcome to Vet Talk. Thanks for having us.
No problem. Great to have you here, as usual.
Now, there's a little bit of action going on in the background. We've got dogs barking and carrying on, but that's just pretty normal for...
pretty much, yeah. This is a day in the life of a vet, listening to noises.
Well, speaking of a day in the life of a vet, you obviously became a vet because of your love of animals, but tell us why you became a surgeon, a veterinary specialist surgeon.
You know, it kind of just happened. So I was very lucky. When I went through... specialisation was quite unusual, and there was less than a handful of vets who were actually registered specialists in Sydney when I came through, particularly in many fields, but surgery certainly there was very few. And a residency program had only just started at the university just after I graduated for the first time, and when I was a very new graduate, I happened to walk into the university and see, I was visiting somebody, and I saw my old professor who knew I was keen on surgery. I liked surgery when I went through, and I was quite good with my hands, so that was useful. I was dexterous, I guess. And he said, "Oh, Sarah, would you like to do a residency?" So I was...
Bingo, hello.
That's kind of unheard of, to be honest. People these days struggle to get to be where I am. So I'm very blessed that I was able to kind of fall into a residency. I had to apply and, do an interview and so on.
You didn't miss out on any skills though, did you?
No.
Teacher's pet, obviously.
But it was just really, I was very fortunate to go through that way, and I did my residency, and I had a very supportive husband and family, and despite having kids in the middle of it all, I managed to get through a residency, got through memberships and fellowship exams and a master's degree.
Wow.
But, it's 10 years of whatever commitment to get to that point. But I always loved surgery. I find... doing things with my hands is much more rewarding than just giving some medication and seeing if they're going to get better. Don't tell the medicine people I said that.
No, we won't tell anyone.
Surgery is, I have to say, maybe more for instant gratification. It comes in broken, you fix it, it walks home. It's a nice feeling to be able to do something.
Mostly they go home fixed, but not always. It can be a bit tough.
That's true. Sometimes they don't go home fixed or don't go home, and that's pretty hard as a vet. We're here to make animals better, and that doesn't always happen, and that can be pretty emotional, and particularly, I guess, as a new vet, that's particularly hard when you first graduate and you might have the first pet die or get euthanized in your care. I remember being devastated the day that I was doing bird surgery on a friend's bird that had been badly torn by another bird, and it died under anaesthetic, and I was just mortified because I guess I hadn't had to deal with that before. And
it was a friend's.
It was so close
and
as well.
because it was a friend's bird, I've learnt to be much more... I guess I give the clients a full range of possibilities of the outcome of a case. So I will always mention possible complications, including death from an anaesthetic or surgery, because even though it's rare, if you've kind of broached that subject, they understand that that could be a possibility.
We should actually point out to people as well that the sounds in the background is not a distress.
We're not torturing.
We're not torturing anyone.
I hope.
Dogs, correct me if I'm wrong.
Maybe some of the nurses.
Correct me if I'm wrong, Sarah, but dogs, particularly coming out of anaesthetic, will often cry and howl like that. Is that right?
Yes, sometimes if they're a bit disorientated, like a person on drugs, they might make kind of vocal noises, not necessarily because they're in pain, but because they're not really aware of what's happening around them. We do obviously don't like to hear them distressed, so we will do...
well, I notice people are actually going over there now.
So if animals make a noise, we usually like to check that they're okay and make sure that they're not showing signs of pain. We're very big on pain relief here.
Absolutely.
And because we're here 24 hours, we can do that at any time. So, sometimes it does distress people. Certain breeds will particularly not like being in a cage. Staffordshire Bull Terriers.
Okay. So all you Staffy lovers out there.
There's a few breeds that they're not actually as bad as some. So certain dogs don't cope so well with being left alone, or as soon as they go and have somebody talk to them, they're usually fine.
Now, we touched on anaesthesia just briefly then.
Yes.
A lot of people worry about older pets going under anaesthesia.
Yeah.
Should they be worried?
Anaesthesia is never 100% guarantee that it's safe for people and animals. So it's important that they understand there is a risk with any anaesthetic. However, if that's the reason not to do something, because an animal's old, I would definitely say don't hold off doing a procedure that the animal needs doing just because you're scared of an anaesthetic. Because often whatever the disease process is that they're needing dealt with is far worse than the small risk of an anaesthetic, and we can minimise those risks. So we minimise them by assessing the patient really well beforehand. We listen to their chest and make sure that their heart is regular and normal sounding, no murmurs, that sort of thing. We will do blood tests to check their liver and kidney function beforehand. And if they do have disease processes that increase their risk, we let the owner know. We manage the anaesthetic differently for that reason. So there's a lot we can do to reduce the risk. So for instance, 18-year-old cat needs to have a dental badly. That cat needs the dental. You can't not do it because it's 18 and go, oh no, I don't want to risk it. If the cat's got dental disease and it's in pain and has infection, that's going to make its health far worse than it. There's no doubt.
And it could live for a few more years.
Oh, absolutely.
That, And they do.
The oldest cat that I ever dealt with, and there've been older ones than that, but the oldest one I ever dealt with was 23.
Wow.
And I was younger than the cat at the time. It's kind of embarrassing when the patients are older than you.
That's cool. People think of anaesthetic sometimes and they think of, Michael Jackson died from
propofol.
Yes. There we go. So, is that what you use?
Actually, we do use propofol quite a bit. We have other drugs that we use as well. Propofol is a fantastic drug because it's very quickly processed. So as long as you use it supervised,
unlike Michael,
yes, under medical attention. If you monitor them, it's actually quite a good drug for dogs that and cats that are unwell. We use it a lot. It's quite a safe drug in the right hands.
There are some injectables as well.
There are all sorts of different injectables. So we can sedate an animal if we need to just keep it still for an X-ray. If it's not a painful procedure, that's different to whether we need to have it anaesthetised for something that's going to cause some discomfort. So
you were mentioning blood tests before, and I guess that adds to the cost of, for instance, if you've got to do an X-ray, keeping a cat, a bird, dog still for long enough to do it. So. This, I guess, brings up the cost of veterinary care. A lot of people, you read on Facebook and places like, oh my God, they're ripping us off. But, I've been working in and out of here for the last year and a half. I can see you guys bend over backwards to save costs.
Absolutely. And look, yes, it's expensive to provide medical care. We don't get any rebates from the government to do what we do. Every laboratory test, every blood test costs us significant amounts of money, and the reagents and the keeping the machine going and the, monitoring it and maintaining it. So, there's costs involved in doing that. And I know there's been debate in the media recently about costs of things and how do vets justify charging so much money. But, we've got to make it profitable or we don't survive. And we can't keep providing the level of service that we do. And particularly 24-hour hospitals like this, where we've got costs of employing people after hours and out of hours is very expensive. And to be able to provide, an MRI could be done at 2 a.m. To be able to provide that level of service is really... it's expensive to maintain those pieces
Absolutely.
of equipment.
And if we didn't have MRIs for animals now, the old-fashioned way would be another exploratory operation, presumably.
Or we just don't get a diagnosis.
Yep.
So animals will be euthanized or die or, have ongoing issues because we never get to the bottom of it. So being able to spend the money on the diagnostic tests is making a huge difference to finding out why animals are sick. There's a lot of diseases we missed before.
So this is where we put in the advertiser's message, get pet insurance now.
Absolutely. If I have any friends who are buying new pets, the first thing I say to them is, get your pet insured.
Okay.
Oh, really? Should I really bother with that? Yes.
Yes, yeah. We know we've had, 5 dogs now, and Yeah.
Look, it's the simplest thing you can do, and look into it. There's obviously different pet insurance companies, but you want one that will cover majority of things that potentially you might have to deal with.
And even if they don't have pet insurance, people can also find other ways. Like, you don't say, give me the money now or else we won't let your animal leave.
We offer people all sorts of options. So we do have ways of paying it off over time. We have companies that will provide that service for our clients, and that can make a huge difference. At 2 a.m, when you've got to decide if my dog needs an emergency surgery for its twisted stomach, how am I going to afford that? Yeah. It gives you an option to do that, and we can look into that online instantly at reception.
So you don't get them in to wash the floors or clean the cups in the kitchen or anything?
That's an idea.
I think some of the nurses would enjoy that. They've got other things that they have to wash. Terrific.
Alrighty.
Let's take a little break and we'll come back with more of Vet Talk TV shortly.
Thank you.
Any member of oncology, please contact reception. A member of oncology, please contact reception. Thank you.